Thank you again, everyone, for joining. You're in the right place for a Gryt Health program with one of our nonprofit partners, Triage Cancer, here to talk about the financial burdens of a cancer diagnosis and how to reduce that. Like I mentioned earlier, material from today will be provided to you via email, and it'll be back on our website as a recorded video. Madison's going to be sharing slides, and anything you hear today is information for you. It's not any legal, medical advice for what you should be doing. You should always kind of consult your medical team if it's medical, family and friends, and your legal resources as well. This is just informational. So that's my little disclaimer I have to always give you guys. So like I said, keep your questions as they come up, keep putting them in the chat. And I will go ahead and hand it over to Madison, who will say hi and then share her screen to show you guys some informational slides. Thank you, Madison, and thanks for everyone for being here.
Thank you so much, Lauren, and thank you for having me and Triage Cancer be here today to spend time with you all. I'm very excited to share this information, so I'm just going to share my screen very quickly and we can get the ball rolling. So I am Madison McMahon Ward. I am the program manager for Triage Cancer, and I'm very excited to be here to share with you all some of Triage Cancer's resources that can help you reduce the financial burden of a cancer diagnosis. So for those of you that are new to Triage Cancer, welcome. We are a national nonprofit organization that provides education on the legal and practical issues that may impact individuals diagnosed with cancer and their caregivers. And we provide this education in a few different ways. So we participate in online and in-person events across the country, and some of these events are hosted by our wonderful cancer community partners like Gryt Health, and then others we host ourselves. So I do just want to highlight some of the events that we host ourselves, because even though we're going to be spending some time with each other tonight, I'm not going to be able to get to all of the different legal and practical issues that might come up. So I want to give you places that you can actually get more information and more resources to help you out. So the first is our Triage Cancer conferences, and this is a free educational event that provides information on different cancer survivorship topics. And this event is free and open to anyone in the cancer community. And we will be hosting 2 of these online this year. Our first one is on May 15th, so in exactly a month from today. So we hope that you all can join us for that event. And Gryt Health is actually one of our wonderful sponsors of this event. So if you love Gryt Health, come check out this online conference. And then if any of you happen to be nurses or social workers or patient advocates or HR professionals, we do offer free continuing education at this event as well. Then we also have a monthly webinar series, which is open to anyone in the cancer community. And these really provide a deep dive into different practical, legal, and psychosocial topics. And our next one is going to be on May 6th, covering health insurance appeals. So if you're ever faced with a situation where an insurance company says no or denies you coverage and you don't know what to do, this is a great webinar to attend to learn how to navigate those issues. We'll be covering health insurance appeals for individual plans, employer-sponsored plans, and then Medicare and Medicaid as well. And then all of these webinars are recorded and then available on our website. So if you missed one of our live webinars or you want to hear the information again, you can access those on our website. Then in addition to all of our events, we offer a number of resources and materials in the form of our quick guides and checklists. And these are just some of the materials that we have available. All of our resources no longer fit on one slide, which I guess is a good problem to have. But all of these are available for free download on our website, or if you want hard copies, we can mail them to you for free. Then if you're looking for an overview resource, we have our new Practical Guide to Cancer Rights. And this provides an introduction to some of the different cancer rights law topics that most people have to deal with in some way after a cancer diagnosis. And it covers things like navigating employment, insurance, and finances. And this is also available for free download on our website, or if you want a hard copy, we can mail them to you for free as well. Because where you live can impact what protections you have access to, we also have charts of state laws on our website that cover employment, disability and health insurance, estate planning, and much more. So this is a great place to go to if you want to see what's applicable to you based on where you're located. And I know we have a lot of people from different states here on the call, so this is a great place to go. We also have a growing number of educational animated videos that cover a variety of different cancer survivorship topics, including health insurance, finances, work, estate planning, and cancer survivorship care plans. And these are all available in multiple languages and also have closed captioning. So if you're someone who would rather watch like a 5 to 7 minute long video on these topics rather than reading a quick guide, these are available to you. So we just want to be able to get the information out there in whatever way you're comfortable receiving the information. And then we also have most of our resources available in Spanish. And then cancerfinances.org is a toolkit that provides information on topics that can impact someone's finances. And this is kind of like a build your own adventure toolkit. So you can come to Cancer Finances and choose a topic and start to answer questions based on your situation. And then it'll tailor the content based on your answers. So this is not only a great resource to use for yourself to find relevant information and financial assistance resources, but this is also a great place or a great resource that you can use on behalf of someone else if you are a caregiver or a healthcare professional. Now let's turn to financial toxicity. I'm sure many of you are familiar with the term financial toxicity because it has certainly become a buzz term over the last few years. But researchers from Duke looked at how the out-of-pocket expenses have a similar type of impact on an individual's quality of life that the physical toxicity of a cancer treatment can have. And they didn't just look at the dollars and cents of it all, but they looked at how that financial impact can diminish overall quality of life. So while this is a relatively new term, it is certainly not a new problem. But the challenge with financial toxicity is that there isn't a one-size-fits-all solution. And part of that is because there are multiple contributing factors to financial toxicity. So we think health insurance status is the most important contributing factor. And that isn't just does somebody have health insurance or not, but does that individual have adequate health insurance for them? And do they know how to effectively navigate those policies? Certainly, employment changes that can occur after a cancer diagnosis can impact someone's finances. And then all the life changes that can happen, like relationship changes or moving or graduating, those can continue to happen after a cancer diagnosis and can compound the overall impact that that person is experiencing financially. So in order to effectively address financial toxicity, all or at least most of these issues need to be addressed. And effectively navigating these changes is often rooted in having a good understanding of the law. So this is a visualization of the many questions that can be asked of someone along the continuum of care to start addressing financial toxicity. And I realize that this can be kind of difficult to see on your screen. So we do have the full-size version of our checklist to avoid financial toxicity on our website. And what you will see on that full-size version is the left-hand side column is going to be all of the questions that can be asked that cover health insurance coverage, practical and personal issues, and employment and disability insurance. And then on the right-hand side is going to be all of the resources that we have at Triage Cancer to help people address the answers to those questions. So we know that if these practical and personal and employment issues are discussed and addressed, people can avoid significant financial toxicity. So now we know that if health insurance status is the primary contributing factor to financial toxicity, that's an actually pretty easy solution. The challenge is that health insurance is so complicated that Americans simply do not understand how it works or how to choose a plan that works for them. In fact, only 4% of Americans could actually define terms used in their health insurance policy. Now, one of the reasons that finding or understanding health insurance is so complicated is because in order to be a truly informed consumer, you essentially have to learn a completely new language. And we have seen from multiple studies that Americans just don't understand health insurance, and we understand why that is. But if right now you're feeling really overwhelmed, you're like, Madison, what terms are you even talking about? Know that you are not alone. In fact, only 40% of Americans say that they are very confident that they can choose the right health insurance plan. So when understanding health insurance, it can be important to know where we actually get our health insurance from. And there are three main places. So the largest group of Americans get their health insurance directly from their employer. The second largest group of Americans get their health insurance through the government, either through Medicaid, Medicare, or the military. And then the smallest number of Americans actually purchase a plan directly from a health insurance company. So there are a few terms that are used in health insurance coverage that you should understand. And there are costs just to have health insurance. And this is called your monthly premium. And it's what you pay every month just to have coverage. And you pay these costs even if you never go to see a doctor or receive any medical care. It's just like how you have to pay for car insurance all year, even if you don't get in an accident. Then there are costs that you have to pay when you use your health insurance. And these are going to be different depending on your policy. And the first is your annual deductible. And this is the amount that you have to pay out of pocket before your health insurance company starts to pay their share of the costs. And this is a fixed dollar amount, and it can vary plan to plan. So sometimes you can see a deductible of $500 or $5,000. Some plans even have a $0 deductible. It really just depends on the plan. Then there is your copayment, or copay for short. And this is a fixed dollar amount that you have to pay each time you receive certain types of medical care. So for example, you see a healthcare, your primary care provider, and you might pay a $20 copay. Or if you go to the emergency room, you might pay a $250 copay. It really just depends, and you usually pay this at the time that you receive care. Then there is what is called a co-insurance or a cost share. And these two things mean exactly the same thing, but it is the difference that your health insurance company will pay for your medical expenses and what you are responsible for paying for your medical expenses once you have met that annual deductible. So you are sharing the costs. So for example, you could have an 80-20 co-insurance, and your health insurance company is responsible for 80% of your medical expenses, and then you are responsible for 20% of your medical expenses after paying your deductible. Then there is your out-of-pocket maximum. And this is probably the most important thing to understand about your health insurance. And again, this is a fixed dollar amount, and it's going to depend on your policy. And you reach your out-of-pocket maximum by paying your annual deductible, any co-payments that you make throughout the year, and then any co-insurance payments that you make throughout the year. So it's everything that you pay except for those monthly premiums. And once you have met your out-of-pocket maximum, your health insurance company is going to cover 100% of your healthcare expenses. And you don't have to pay anything else except for those monthly premiums. So by understanding how out-of-pocket maximums work, you can plan around what might be a worst-case scenario and hopefully avoid financial ruin after a medical situation. And when thinking about out-of-pocket maximums, it is important to note that most health insurance companies will only count costs that from in-network providers. So they might not count any expenses that you have from an out-of-network provider. So to better understand how an out-of-pocket maximum works, meet Dan. Dan has a health insurance policy with a deductible of $2,000, a co-insurance of 80/20, and an out-of-pocket maximum of $8,000. Dan was in a car and had to go to the emergency room and then spend a week in the hospital that was in his network's policy. He ends up with a $102,000 hospital bill, but how much does he actually have to pay? So remember, he first has to pay that $2,000 deductible, and he's left with $100,000. So now that he's met his deductible, his health insurance company will start paying their share of the costs. So they're going to cover 80% of that $100,000, and he's responsible for 20% or $20,000. But remember, he has that out-of-pocket maximum of $8,000. So he's already paid $2,000 in deductible, which means he only has to pay another $6,000 of that $20,000 in order to reach that out-of-pocket maximum. So while I am certainly not saying that $8,000 is a small amount of money, it's still a lot of money. Compared to the alternative of $20,000, it is more manageable. So you can see from this example how that out-of-pocket maximum can help reduce that financial burden and that out-of-pocket expense. Because if Dan didn't have this out-of-pocket maximum, he would have been responsible for $20,000. So if you want to hear this example again, or you think this is the best example of out-of-pocket maximums I've ever heard, I want to share it with the world, we do have it available in our Health Insurance Basics animated video. Then finding the right health insurance policy can be overwhelming. And it can be especially overwhelming when you have to compare multiple options. So whether you're buying a plan in the marketplace and want to compare different marketplace plans, whether you're comparing 2 or more employer plans, or whether you want to compare a marketplace and employer plan, or you want to compare your Medicare options, you can do so. And when comparing plans, it can be tempting to choose the plan with the lowest monthly premium. So our bronze plan here has a monthly premium of $173. Our silver plan has a $271 monthly premium. And then our platinum plan has a $398 monthly premium. But to figure out how much you actually have to pay, you can't just, by looking at this example, what you see on the screen right now, actually tell how much it's going to cost you. You actually have to do some math. Now, me personally, math is not my favorite thing to do in the world, so I promise you that this is not a very complicated math equation. So first, you take your monthly premium and multiply it by 12, which is the amount that you're going to have to pay annually for your premiums. Then you're going to add that annual premium amount to your out-of-pocket maximum. And this is the most that you're going to have to pay out of pocket for your medical care during the year. And if you have a serious medical condition or go to see the doctor very often, you are more likely to reach that out-of-pocket maximum. So at first glance, it may seem like the bronze plan with that lowest monthly premium is the most affordable, but when we actually do the math, we see that that platinum plan is actually more affordable, and kind of significantly, I might add. But there are some other things to consider when looking at the cost of a plan. So some plans have a high deductible, which means that you have to pay a lot of money up front before your health insurance starts to pay their share of the cost. For example, some plans can have a deductible as high as $8,550. And then other plans may have a more expensive monthly premium, but then have a very low deductible and a low out-of-pocket maximum, which helps spread out the cost that you have to pay throughout the year, which might be a little bit more manageable than paying a lot of money up front. So after you have looked at the cost of a plan, then you need to see if your doctors and other healthcare providers are within your network. Many plans will not cover medical care that you receive from an out-of-network provider. And even if they do cover some of those costs, you will likely have to pay more out of pocket. And then finally, you should make sure that your plan covers any prescription drugs that you are taking. Otherwise, you're going to have to pay more out of pocket to access those medications. So another important thing to consider about health insurance is when you can actually purchase it, because you can't purchase it at any point in the year. Medicaid applications are accepted year-round, but Medicare has an open enrollment between October 15th and December 7th. Employer plans have their own open enrollments, and those can vary, but they often fall within the fall when other open enrollments are happening. And then the 2022 Marketplace open enrollment will be from November 1st to December 15th of this year. But we are actually in a special open enrollment period right now. And the 2021 Marketplace has been reopened and will be open through August 15th. And this is due to the pandemic. So if you want more details about this specifically, you can check out our blog. So this is a really unique opportunity to purchase health insurance or make changes to your plan because we have that special open enrollment happening right now. And today I don't really have enough time to talk about health insurance marketplaces, but we do have a quick guide to health insurance marketplaces if you would like more information on navigating those. And then it's important to note that the plans in asterisks are calendar year plans. So even if you purchase a plan for the 2022 open enrollment on November 1st, you have to wait until January 1st, 2022 before it starts. And then outside of this special circumstance that we're in now, you have to be reviewing your options every year or every time your job changes. Unfortunately, health insurance isn't a one and done type of thing, so it's important to be reviewing your options. And we do have a checklist to employee benefits during a job search and making the most of employee benefits during open enrollment that can help you navigate these situations. And then even if you have the best health insurance policy for you, you may still end up with high medical bills, which is why we have developed a partnership with Co-Patient to help individuals diagnosed with cancer avoid overpaying for their health care. So through this partnership, the fees of Co-Patient for 12 months will be waived if you sign up through Triage Cancer by June 30th, 2021. And Co-Patient offers services like professional bills reviewing, appeals, and negotiation of payment plans. And then we know that some individuals who have faced significant financial burdens may look towards bankruptcy as an option. So we have partnered with Upsolve, which is a free nonprofit tool that helps you file for Chapter 7 bankruptcy completely for free. So you can think of this as like TurboTax for bankruptcy. So if you want more information on these partnerships and how you can access them, we do have this information on our website and on our blog. And then during the time that I've been with you today, have really only given you an introduction to some of the different health insurance information. So we have tons of resources on health insurance on our topics page. We also have a health insurance module on cancerfinances.org. And we have some recorded webinars about understanding Medicare and health insurance. And if you want to take advantage of this special open enrollment that we're in right now, and you want more substantial information, I do recommend checking out that recorded webinar on how to choose and use your health insurance. We will be having a live webinar on health insurance in October. But if you need this information sooner, that recorded webinar is a great place to go. And then we also have many quick guides that cover health insurance. Couldn't list them all here, but you can go to our health insurance topic page to find more of those resources. So I am open to any questions that might be coming in.
Yeah, thanks, Madison. As she said, Triage Cancer offers more than you could ever imagine on their website. So it's okay if you're not catching the links here. I'm going to follow up in my email to everyone with some of these key links. But there was a question that you ended up answering yourself. Andrea asked about the guides and the webinars being translated to Spanish. So the webinars are also translated as well?
Our webinars are not currently translated to Spanish. We are actually working on having some of our webinars in Spanish right now. So once those resources become available, I can share them with you, Lauren, so that you can share it with everyone on this call. But most of our quick guides and then our animated videos are in Spanish.
Great. Yeah. And in the chat, some people were talking about, and, me agreeing that health insurance is difficult, doesn't always seem fair, is not fun, but that is really why it's good to have these tools and resources to go over your options if you don't know what the heck's going on, or even if you think you know what the heck is going on. It's really good to have these walkthroughs and these tools. And just wanted to make mention that of someone that offered something is that certain cancer centers and different types of hospital systems do offer financial assistance sometimes, either through like charity funds, different things like that, or hospitals, if you call up and try to pay your bill in full, they might give you a certain percentage off. So there are things you can also always do financially to just look around, call people, ask. I mean, what's the worst that can happen? You fill out an application and get told no. Same thing when it comes to prescriptions. Certain drugs have patient assistance programs and things like that as well. So, so yeah, thanks for Nancy in the chat mentioning that. But yeah, I think we are good on questions for this first part. So I will hand it back over to you, Madison, and you guys feel free to add any comments, questions, anything like that in the chat. We'll get to those again further down the slides.
Awesome. So now turning to some of those other contributing factors to financial toxicity that I discussed earlier. So when looking at employment rights, we know that there are a lot of challenges for individuals diagnosed with cancer and their caregivers when going through treatment. And battling assumptions is one of those challenges. And this includes battling assumptions about yourself as an employee and what you feel like your ability to work is, battling any assumptions from your employers about their view about what your ability to work is, and then even battling assumptions from your healthcare providers. And employees battling assumptions are often pushed out of work or towards disability insurance, and in either case, their income drops, which impacts their finances. But the reality is that there are actually many places to go when talking about employment rights. And that is because there are a lot of laws around employment that may be useful for individuals in the cancer community who want to take time off work or want to work during treatment. And we provide information on all of these topics related to the cancer community. But just to kind of briefly highlight some of these, we have fair employment laws like the Americans with Disabilities Act or the ADA. And that is offered at the federal level. But then there are also state fair employment laws, and they may have more protections. So it's important to, again, look at that chart of state laws that we have to see what is available to you based on where you live. There are leave laws like the Family and Medical Leave Act, and then there are also those state leave laws. So again, plugging at that chart of state laws to see what is applicable to you. But then we also have employment and union contracts. And if you work under an employment or union contract, you may have other benefits available to you. And it's important to remember that the law only provides the bare minimum for what an employer has to offer an employee. So we often recommend to people to look back at their employer policies because you may have benefits that you aren't aware of. If you're starting a job, you usually get handed like a stack of paper and are just signing away. So you may not know that you actually have disability insurance, for instance, because your employer has been paying 100% of those premiums and you don't remember signing that paper. There may be other benefits that are available to you as well to help you take time off or, negotiate or adjust your schedule, things of that nature. So if you're looking for these type of, if you're dealing with employment issues, always look at if you're an employer contract. And I just want to mention that we have that checklist to making the most of employee benefits during open enrollment and employee benefits during a job search, which can help you navigate these situations as well. But one of the most underutilized tools to help battle these assumptions is reasonable accommodations. And the legal definition is any change in the work environment or in the way things are customarily done that enables an individual with a disability to enjoy equal employment opportunities. So I understand that that definition is not really clear. So the best way to talk about reasonable accommodations is actually by using examples. And practically speaking, that can be anything. And reasonable accommodations fall within 3 categories. So the first one is about adjusting physical workspace. So this could be about moving offices or getting special equipment or furniture. It could be about getting a parking space closer to your office entrance. And then it could also mean telecommuting. And now when we think of telecommuting, we often think of working from home. I know I've been working from home, but it's important to know that telecommuting can also mean working at a different location than from where you normally work. So if your employer has multiple offices, it could be about working at a different office than you normally work. And that could be useful for multiple reasons, including cutting down on your commute time or thinking about the number of people that work in your office. So those are some examples of reasonable accommodations around adjusting your physical workspace. Then we see needs around a change in schedule for someone coping with a cancer diagnosis. And there are different ways to adjust your schedule as a reasonable accommodation. So it could be about working part-time, it could be about just adjusting your number of hours or having a more flexible schedule or taking additional breaks. And then it could also mean taking extended leave, which I will get to in just a little bit. And then our last bucket is basically everything else. So it could be about using technology. So for somebody that is experiencing neuropathy in their hands and has to type all day, maybe they could use a speak-to-type software to help them out. It could be about a change in policy. So for somebody who works in an environment with a very strict dress code and they want to wear a hat or a jacket because they're experiencing temperature sensitivity, maybe there can be a change in that policy so that they can wear that hat or jacket and enjoy equal employment opportunities. And then it could also be about shifting job responsibilities. So for example, a school teacher who is also responsible for doing the drop-off line in the morning or recess duty at lunch, maybe those extra duties can be shifted to someone else if they're experiencing fatigue, and that teacher can just rest during those times. And then finally, it could be about changing jobs entirely with your employer. Now, this only works if there is already a vacant position available, so your employer is not required to create a new position for you. But if there is a vacant position and you are eligible for it, it could be about shifting to that other job. So since reasonable accommodations are such an important and underutilized tool to help work during treatment or take time off, we do have a lot of resources on reasonable accommodations on our employment resource page, as well as a quick guide and a checklist. And then we have an animated video. And then again, we have a recorded webinar on managing side effects at work and at school that we recorded last year. So if you are thinking that reasonable accommodations might be something that is useful for you and you have questions about how to request them or what to do if they're denied, check out that recorded webinar. It really provides a deep dive into all those different topics. And then if somebody wants to take extended time off, like I mentioned, there is the Family and Medical Leave Act, or the FMLA. And that is a great way to take both job protected and health insurance protected leave. So the FMLA allows eligible employees to take time off for a serious medical condition or to take care of a child, a spouse, or a parent with a serious medical condition. And states may have their own options and rules, so you can look at our chart of state laws to see what is available to you in your area. And then the downside of FMLA is that it is unpaid leave. So if you need to take leave and want to replace some of those lost wages, disability insurance might be a good option. And I think that it can be easy to write off disability insurance if it's offered to us through our employer, or thinking about purchasing it through a private disability insurance company. But I just think this is a very interesting statistic that a 20-year-old has a 1 in 4 chance of dealing with a disability before retirement age. So disability insurance can be something that is very useful. But disability insurance replaces income that you lose because you are not working due to your medical condition, and it typically does not cover 100% of your monthly income, so it usually only replaces somewhere between 45% to 90% of your monthly income. But there are several places that you can get disability insurance, either at the federal level, at the state level, or then directly through a private disability insurance company. And disability insurance can be very complicated, especially at the federal level. So I'm not going to really get into the weeds. So if you have a lot of questions about disability insurance, if you're currently applying or on disability insurance or thinking about it as an option, we do have a lot of resources around disability insurance for you. Again, we have a cancer finances module on it, a recorded webinar that really takes a deep dive into all these issues. And then we have a number of quick guides as well to help you as well. So during our time today, I have really just provided an introduction to health insurance and some employment rights. But there is a lot more that could be said about these issues. And I've really only scratched the surface of other cancer-related legal issues. So these are some of the other issues that you may come across after a cancer diagnosis. And I do want to mention that we have resources on all of these issues on cancerfinances.org and our resources by topic page. And I know I've mentioned our topic pages a few times tonight, but this is really a great place to start if you have questions about a specific topic. As I mentioned, and as Lauren mentioned, we have so many resources. So it can be a little overwhelming to go to our materials page or a resources page if you don't really know where to start or what exactly you're looking for. So this is a great place to go to get information because we've compiled all of our relevant resources onto one page. Then if you are exploring our resources and you still have questions, that is totally okay. And we have a new legal and financial navigation program that provides free one-on-one assistance for individuals diagnosed with cancer, caregivers, and healthcare professionals. Really anyone in the cancer community can utilize this program. And what you can do is go to triagecancer.org/gethelp, and you will be asked to fill out a brief online intake form so we can get some information to start learning about what you're going through. And then one of our staff members will reach out by the next business day to get connected. And what we will provide is relevant resources and accurate information as you navigate health insurance, employment issues, disability insurance, estate planning, and then many other cancer-related legal issues. So if you're dealing with a very complicated situation, or you're caring for someone with a complicated situation, know that this is a great place to go for that one-on-one assistance. And then I hope that you stay connected with Triage Cancer. And I do just want to plug one last time that conference that we have on May 15th. It's a great place to go to learn much more information about all these topics and more. Then you can also read our blog if you want to stay up to date on all of the late breaking news and what is happening at the federal level or at the state level that may have an impact on the cancer community, because that is where we are taking in all that information and giving it to you all. And then if you want to stay up to date on all of our upcoming resources and new events, you can sign up for our newsletter or get connected with us on social media. So if there are any more questions or comments, I'm happy to talk about them.
Thank you, Madison. I know I learned a lot. You can go ahead and stop sharing your screen for us if you don't mind. I mean, you touched on things that were so incredibly relevant, like, so many people get neuropathy in their hands from certain treatments, and, a reasonable accommodation being asking for something, software that you can talk and it'll type for you. Like, hello, never would have thought of that. And then same with temperature changes. I know myself as a cervical cancer survivor, I was always going through hot flashes. So I'd be hot, cold. And I just kind of let my employer and my coworkers look at me and let them think I was crazy without saying anything. But, if it's a strict uniform policy, that's absolutely something to bring up. So great points. Dan, you had a question. You can go ahead and unmute if you'd like.
Thanks, Lauren. Hi, Madison. I'm with the Gryt Health team. Question for you. So I know that, especially in upstate New York, something that's happening is a lot of providers are moving out of network in order so that they can recoup more money from appointments. I was wondering if there's any kind of for cancer, are we seeing better coverage or more in-network coverage? Is there any kind of like generalizations you can make about that? And are we able to keep a lot of the cost of care in network for patients close to where they are, or are people having to travel?
Good question. I think it really depends on the plan, because it's true that, if you do have like the best health insurance and all, you have like the lowest deductible or the lowest out-of-pocket maximum, but then if you don't check if any of your providers or your oncologists or anything that you get healthcare are not in your network, then that plan isn't really useful to you, because then you have to pay a lot of money out of pocket. Which is why we always say to check for your providers and your prescription drugs that are in your network. But in terms of, I know that providers can change what health insurances they accept, and that can create a difficult situation, which is why we also mention reviewing your options every year, because you want to check that if your provider has changed and they no longer take your health insurance policy anymore, maybe you have to get a different type of health insurance policy that is in that network's provider, or that provider takes, in order to continue seeing that provider. But I hope that helps answer your question. But just like the bottom line is always reviewing those options and checking and calling calling your providers to actually talk to someone to see if they provide it, because sometimes they do have that information on their website, but that can go out of date, really quickly that we've seen. So great question.
Yeah, that's important too. Switching insurance plans or, moving and switching insurance plans, not just, I've gone on and logged on to like my new plan to check and see if my previous doctor's in there, and it'll say, yes, in network. And then, to double check, I always call, because the last thing I want to do is drive 2.5 hours for an oncology appointment where I'm already freaking out, and then be like, this is going to be $600.
Yeah.
So calling, that is always huge. So even if you see something online about your provider or your insurance plan, if you're leery, you're not sure, you want to double check, call them. That's what they're there for. Looks like we had another question from Leah in the chat, asking about if your insurance company seems to be kind of flip-flopping back and forth on, we'll cover that, no, we won't cover that, and getting kind of differing information. Is it kind of time to bring a lawyer in, or is there any advice you have on how to handle that?
So I would say that if they're, kind of flip-flopping, it could be important to also ask if you can get a pre-authorization for the type of medical care that you're seeking. And then if they do deny coverage after receiving that medical care, appealing that decision is very important to, try to make sure that you don't pay out of pocket for that. And then I'm just going to plug again that May 6th Health Insurance Appeals webinar that is going to provide a lot of information about that. There are professional bill reviewers that you can contact, and we have some of that information available on our website, but then also that partnership with Co-Patient does that. So you might not necessarily have to contact a lawyer for that, because they might not be the best professional to help with that. But if you are looking for legal assistance, we do have a quick guide to legal assistance, which can help break down that decision and see if it's the right decision for you. But thank you. I'm glad that was helpful. So yeah, there are resources that we have, and it can always be dependent on your situation. So if you're dealing with something really, more complicated and you're getting really frustrated with that health insurance company, feel free to reach out to us through that legal and financial navigation program. We can definitely provide some one-on-one assistance with that.
That's great. Yeah, I knew you guys had incredible stuff, but I didn't even know about, being able to call or fill out a form, then somebody get back to you, because I know the last thing you want to do is try to read through this stuff and mess and money and bills and legal when you're literally just in treatment and trying to survive, or out of treatment and want to go back to school. And it's so good that you guys are available to just be there and, talk to somebody one-on-one. That's amazing.
Thank you.
So, yeah. Are there any other questions for Madison? Anything like that? Oh, Betty in the chat made a good point. And people can run into this commonly, especially with medications. If somebody's proposing one thing to do medically or treatment-wise, medication-wise, and you contact your insurance to check it, or they do, and they say, oh, not covered. And you're like, but my doctor said I needed this. What do you mean it's not covered? You can call back and ask your doctor for an alternative. There are alternate medications. Maybe it's not necessarily the exact same thing, but there's normally always differing options. Same thing with like if it's a prescription medication you're going to go pick up at the pharmacy. I know I showed up at Publix this flu season because I wanted my $10 Publix gift card for getting my flu shot. And they're like, oh, we don't take your insurance. We're not even going to give you a flu shot. And I was like, what the heck? I'm trying to get my free gift card here for my Publix sub, but that didn't happen. So then I had to call and say, okay, well, where can I go and where do you recommend me to go? So Dan, I don't know if you wanted to just chime in or maybe give a little bit better explanation as to there are alternatives for one medical problem and different medicine available.
Yeah, sure. So, Lauren, you bring up a great point. So different insurances will cover drugs at different costs, and we all kind of know from going to CVS that it really varies. A lot of insurance, one of the ways they try to bring down costs is to make deals with one drug company and not another. So for the same drug, like a statin, where there's 5-6 different statins on the market, they'll make a deal with one company and then take the others off formulary. These are prescription drug formularies, is what they're called. So it's really important to understand your formulary, but it gets incredibly complex very quickly. The person to ask is really the person at the front desk in your doctor's office. It's a lot of patients ask their doctor, can you look up and see what the thing to prescribe under my plan is. The docs don't always have the best knowledge of that, and it really it can make a big difference. There are a lot of other organizations that I know are trying to offer services around this. People like GoodRx tend to have really good information about formulary. Madison, I don't know if there's other places you can suggest such that people might be able to lower their drug costs, because it gets crazy very quickly.
Yeah, we actually have a partnership with Needymeds, and we have a drug discount card, and that is similar to GoodRx, that you can have this card with you and present it at any pharmacy. It's not like a health insurance plan. You don't have to actually provide any of your information. You don't have to pay anything, but you can show this card at a pharmacy, and it starts a conversation to see if there are any discounts that you can have on your drugs, and that can save people significant out-of-pocket expenses. So that drug discount card, and then GoodRx you mentioned is another one that is doing some good work in that area.
Yeah, great point. Thank you, Dan. Those of you that don't know, Dr. Dan Platt, he is our Chief Medical Officer, not just some guy I'm asking about medical information from. So thank you. Another thing too, I just want to say, I had seen Megan Claire, she's on tonight. She had said she actually did call Triage Cancer, several years ago to get that one-on-one help. And in that vein, to just always advocate for yourself. There was a time where my doctor, not cancer related, but just wanted me on a crazy eye drop that was going to be $300. And so then I went and looked around and saw where other pharmacies, other stores that carried it to see if I could get it cheaper. And I got it under $100. So I did have to call up the doctor's office and say, hey, I'm sorry, to be a pain, but where you sent it, it's going to be $300. So please send it again somewhere else. And so you can do that. You can absolutely do that. A doctor or a nurse or the office might try and give you a hard time. That's just because it's extra time on them. But I promise you, they can change where they send a prescription. Even if you're getting 5 of them from one pharmacy and realize you want to get one at a different, they can do that. So you have the power to call and get that changed and advocate for yourself on that. Just one quick last question. Andrea was asking about integrative medicine. So a lot of the time, if not all the time, it's not covered by health insurance. Do you have any inclination of if that would be happening soon by any chance, or still kind of avoiding it?
I do not, but I can definitely, check to see if there is anything happening, but currently I'm not aware of anything.
Okay, yeah. And I know that's something, Dan, I see you unmuted, we've talked about in our meetups before, and why it is so expensive to go and do that.
Yeah, and for anyone who isn't aware, so integrative medicine is a new part of oncology where some oncologists are moving out of their typical practice and opening up to see patients for a longer period of time and also offer more holistic care, and whether that be in care around kind of everything and kind of try to cover the whole body, the mental aspect of cancer. This is it's a really good movement, but as it currently stands, because those appointments are so much longer and people are taking more time, a lot of those doctors are not are not making deals with insurance plans to cover the costs, because they need the actual extra money from out-of-pocket costs. I'm hopeful that eventually it'll kind of move in that direction. And I know that a lot of oncologists want to spend more time with patients, and it's just the nature of the beast right now in terms of kind of the way the healthcare system works. It's worth looking in your area to see if there are integrative doctors and check in with them to see whether they take insurance. But as of now, it's not, unfortunately, as common. So,
yeah. Thank you, Dan, for explaining that. I appreciate that. So we are just about at time, so I want to stop and thank everyone for coming, showing up today, asking great questions, giving great feedback, and ultimately, thank you, Madison. That was great, very clear, concise. I learned a lot. I know everyone else learned. And like I said, I will be sending an email out, and I'm going to get a bunch of those great links from Madison. And in the meantime, if you can't wait, go on to Triage Cancer's website. Like she said, their resources are kind of filtered by topic, and you can kind of click around. Once you start clicking around on their website, you will see how much they offer, and they are one of, if not the top dog in the cancer world of this kind of help and resource. So thank you again. The next Gryt Health event you can find on grythealth.com/events. And that is going to be our next member meetup, is happening next Tuesday at 7 p.m. Eastern. So that's where we just hang out, talk, chat. We can complain about insurance then if we need to after this program. So come join us next Tuesday to hang out, and be on the lookout for a follow-up email from me with some extra information from Madison. And like I said, this will be, it was recorded, so it will be up on our website eventually. So thank you everyone again. And thank you, Madison. Thank you, Triage Cancer. We love having you guys as a partner. Thanks everyone.
Thank you.